Cognitive behavioral therapy for anxiety. Cognitive behavioral therapy, or CBT, is perhaps the most researched of all therapies for anxiety. This kind of therapy mainly focuses on what an individual thinks, how these thoughts are affecting him emotionally, and how these thoughts affect his behavior. When a person is anxious, this can cause his manner of looking at things and evaluating them to become negative. The role of a cognitive behavioral therapist is to let the person see the connection between his negative thoughts and mood. Through cognitive behavioral therapy, an individual will be able to take positive control over his own negative emotions and change his behavior. Cognitive behavioral therapy has become a popular treatment for people with anxiety disorders and has become highly recommended by the National Institute of Health and Clinical Excellence, or NICE. Those who are suffering from panic disorder, generalized anxiety disorder, and social anxiety disorder may benefit greatly from cognitive behavioral therapy. As the name suggests, CBT has two major components. The first major component of CBT is cognitive therapy that involves examining negative thoughts and how they contribute to one's anxiety. The second major component is behavior therapy that examines an individual's behavior and how he reacts to what he considers anxiety-provoking situations. CBT functions with the fundamental belief that it is our thoughts and not external events which influence our feelings. It also means that it is not the situation per se that determines our feelings, but it is how we perceive the situation that contributes to our feelings of anxiety. One advantage of CBT is that it can be used for treating people who have anxiety disorders of varying severity. In other words, CBT can be used not only for people who have a severe case of anxiety, but it can also be effective for treating people who have just started to manifest some symptoms of anxiety. CBT has to be administered by a trained therapist and is often conducted in a clinical setting. This is the kind of therapy that focuses on the here and now. CBT does not aim towards delving deeper into the root causes of anxiety, so it does not focus on the past. Instead, during the CBT sessions, an individual will be asked to identify his problems together with the feelings and behavior that are linked with that problem. Careful examining of one's thoughts and behavior patterns will help make it easier for the person to make some positive changes and be able to better manage his anxiety, if not totally eliminate it altogether. Each CBT session will typically last for 50 minutes. Individuals undergoing CBT may be given homework that must be carried out and completed between the sessions. This homework often includes regular monitoring of one's own thoughts and behavior by writing them down in a diary or journal. Cognitive behavioral therapy is known to not only be effective, but it is also known to be the fastest way to elicit positive results. According to research, individuals who went through CBT experienced great improvement in their anxiety symptoms after only 16 sessions. This is the biggest advantage that CBT has over any other therapies, which may take years before the person can reap the benefits of their treatment process.